Welcome to part 2 of nursing practice questions and answers about prenatal period. Now let's start with the first question. The nurse is performing an assessment of a pregnant client who is at 28 weeks of gestation. The nurse measures the fundal height in centimeters and note that the fundal height is 30 centimeters. How would the nurse interpret this finding? So these are the options. Option A, the client is measuring large for gestational age. Option B, the client is measuring small for gestation age. Option C, the client is measuring normal for gestational age. Option D, more evidence is needed to determine size for gestational age. Now for this question, the correct answer is option C. The client is measuring normal for gestational age. Now let's move to the rationale. During the second and third trimester, fundal height in centimeter approximately equal the fetal age in weeks, positive or negative 2 centimeter. Therefore, if the client is at 28 weeks gestation, a fundal height of 30 centimeter will indicate that the client is measuring normal for gestational age. At 16 weeks, the fundus can be located halfway between the symphysis pubis and the umbilicus. At 20 to 22 weeks, the fundus is at the umbilicus. Now let's move to the second question. The nurse is performing an assessment on a client who suspects being pregnant and is checking the client for probable signs of pregnancy. The nurse will assess for which probable signs of pregnancy. Select all that apply. These are the options. Option A, ballotment. Option B, Chadwick sign. Option C, uterine enlargement. Option D, positive pregnancy test. Option E, fetal heart rate detected by a non-electronic device. Option F, outline of fetus via radiography or ultrasonography. So for this question, the correct answer is option A, ballotment. Option B, Chadwick sign. Option C, uterine enlargement. And option D, positive pregnancy test. Now let's move to the rationale. The probable signs of pregnancy include uterine enlargement, Hager's sign, Gödel's sign, Chadwick's sign, ballotment, Braxton Hicks contraction, and a positive pregnancy test for the presence of HCG. Positive signs of pregnancy include fetal heart rate detected by electronic device at 10 to 12 weeks and by non-electronic device at 20 weeks of gestation. Second positive sign of pregnancy, we have active fetal movements palpable by the examiner and an outline of the fetus by radiography or ultrasonography. Now let's move to the third question. A pregnant client is seen for a regular prenatal visit and tells the nurse about experiencing irregular contractions. The nurse determines that the client is experiencing Braxton Hicks contraction. On the basis of this finding, which nursing action is appropriate? So these are the options. Option A, contact the primary healthcare provider. Option B, instruct the client to maintain bed rest for the remainder of the pregnancy. Option C, inform the client that these contractions are common and may occur throughout the pregnancy. Option D, Call the maternity unit and inform them that the client will be admitted in a preterm labor condition. Now for this question, the correct answer is option C. Inform the client that these contractions are common and may occur throughout the pregnancy. Now let's move to the rationale. Braxton Hicks contractions are irregular, painless contractions that may occur intermittently throughout pregnancy. Because Braxton Hicks contractions may occur and are normal in some pregnant individuals during pregnancy, there is no reason to notify the primary healthcare provider. This client is not in preterm labor. Therefore, the client does not need to be placed on bed rest or be admitted to the hospital to be monitored. In my presentation, my reference book have used Saunders Comprehensive Review for the NCLEX RN Examination 9th edition.